Wonderful. Todd, thank you very much. Coming up after the short break, we're going to meet some of those amazing faces behind Baptist Health's Keep On Amazing campaign, a husband and wife, and you're going to want to hear their story coming up after the break.
Welcome back to Good Morning Arkansas. You know, you may know someone personally that has had a kidney transplant, or you may actually have had one yourself, but what are the chances of both a husband and wife needing a kidney transplant and almost at the exact same time? Well, that's what happened to Annie and Lynn Davis here at Pine Bluff, and they are here helping Baptist, and they are Baptist Health with their campaign, Keep On Amazing. It's a campaign that you probably have seen them on television and commercials, and now on Good Morning Arkansas. I walked into the studio and I said, you guys look familiar. But it's so good to have you on the show. That's amazing. You two have been married for 37 years. I'm sure when you met, you probably never dreamed that both of you would need a kidney transplant at the same time.
No, not at that time. We did not.
Yeah. Now, Annie, what were your symptoms, and how long ago was this?
Well, the transplant was done on April 17th, a year this past April. Some of the symptoms was frequent urinations, low energy level, back problems, being out of breath after walking for certain lengths of times, and it varies with each individual.
And that's why I want to ask you, and if it varies from individual to individual, what were your symptoms?
My symptoms were similar, the same as hers, but it was swelling of the feet and fluid buildup, loss of energy, eyesight, you know, just different things that we realized that something was really wrong, and we had to check into it. So.
Now, which one of you found out first that you needed a kidney transplant? Which one of you found out that information first?
I think both of us found out about the same time.
What was going through your mind when you thought, well, one of us, but what? I mean, can you believe both of us?
Boy, I panicked. It was almost like my world was crumbling around me, you know, but we began to comfort each other, and we prayed, and we talked to our children and our grandchildren. And I woke up one morning, I said, well, God is not through with me yet. So after then, we decided we were going to do everything we possibly could to stay on this earth. And we were told about the kidney transplant, and that's where we started working.
Lynn, what was harder, your transplant or your wife's?
I think it was more harder for my wife than me, because I've been used to being around people. My father was a diabetic, and he passed away 30 years ago, and he couldn't receive a kidney at that time. So, you know, I was off into it and been involved with it for a while, but I was more concerned about her than I was me at the time.
Well, this has been a little bit more than a year.
Yes.
And you guys look great. How do you feel, Annie?
I feel great. I really do. I'm able to get back into my exercising and my normal routine activities, get back in church, to different groups at church, and the choir, of course. I'm just feel good, and he's back into hunting, deer hunting and rabbit hunting. He loves his hummingbirds, and he's back on the four-wheeler. So we're almost back to where we were before.
What would you say to, you know, I've got to renew my driver's license. I got the notice in the mail. What would you say to somebody who's thinking about becoming an organ donor?
I would say that it is wonderful to be able to bring the sunshine in someone's life, because someone brought the sunshine back into our lives. And if you can help somebody, I feel that your living won't be in vain. And I think this is a chance for Arkansans to just pitch in and to help and to donate if possible.
And I bet you guys are getting recognized wherever you go, don't you?
Oh, yes, we're getting recognized because we're all over the state of Arkansas on billboards and everything. So we're proud of what's going on with us, and we're proud to get the message out to other people that they can get help.
Yep. And I think on behalf of everybody who's watching this right now and from our staff, we're very happy for you.
Thank you.
And hope that you have many, many, many more years left with your children and your grandchildren. And thanks to Baptist Health and their...
Definitely, yes.
All right, well, they have a great staff over there. Thank you so much for making the trip up here to Little Rock today.
And thank you so much.
It is so good to see you. Congratulations. Good to see you. All right, coming up next here after the